Hello, my name is Dr. Christopher Wilson. I have been in practice in the Denver area since 1983. My training is orthopedic surgery as well as microsurgery and hand and upper extremity surgery. I take care of the entire gamut of hand and arm problems. My area of special expertise and interest has been nerve compression syndromes in the arm and hand. These tend to cause pain in the shoulder area, the elbow area, as well as the hand and the wrist. I like to refer to hand and arm nerve compression syndromes as the Rodney Dangerfield of hand and upper extremity surgery, because most physicians are not comfortable diagnosing and treating hand and arm nerve compression problems. One of the biggest problems is that electrical tests called an EMG are usually done. Frequently, the electrical tests do not show many of these diagnoses. Common theme in the cause of all upper extremity and hand nerve compression syndromes is muscle hypertrophy. And I think everybody understands that when you use muscle tissue a lot, heavily and repetitively, muscles get bigger. As muscles in the arm, the elbow, the wrist, and the hand, including the carpal tunnel, get bigger, those muscles take up space and they end up pushing and pinching the nerves. And that's how the majority of arm and hand nerve compression syndromes happen. So there are many locations. I do have a model here of an arm and a hand. Here's the shoulder on the outside. Here's the armpit area. The yellow structures are the nerves coming down. Two of the more common locations where nerves can get pinched in the forearm and elbow area are the ulnar nerve coming down here behind the funny bone at the elbow, and the median nerve in what's called the pronator tunnel. All of the orange tissue here is muscle, so you can see how all of these nerves are surrounded by muscle, and as those muscles get larger, they take up space and pinch the nerve. Here's the carpal tunnel area down at the wrist. It's the same problem there. There are muscles called the lumbrical muscles that get enlarged and take up space in the carpal tunnel and cause pressure on the nerve. On the dorsal side of the hand, the back of the hand and the forearm, the radial nerve passes between layers of muscles here, and that nerve frequently gets compressed by heavy and repetitive use, such as with keystroking all day. So all of these pinched nerves have a common theme in their cause, and they have a common theme in effective treatment. And the effective treatment is to change the anatomy so that the nerves are not pinched anymore. If any of these problems is treated early with ergonomic changes and therapy and splints and injections, that can be helpful, but the majority of the patients I see have had symptoms for years, and it usually requires surgery to change the anatomy so the nerves are not pinched anymore. And when nerves are pinched down in the elbow and at the wrist, they frequently cause trigger points in the neck and the shoulder girdle, and a lot of people have trigger point treatment, which gives only temporary relief. But when I release their pinched nerves in the elbow and the wrist, very commonly the trigger points in the neck and shoulder girdle are gone immediately after surgery. My philosophy on seeing patients here in the office is I run my office hours on time. I believe that patients' time is just as important to them as my time is to me. The address here is 8550 West 38th Avenue, Suite 106. Our phone number is 303-421-1440.